Good morning, everyone. My name is Bernardo. I'm a CrossFit Level 1 coach, but also a primary physician. So I'm the head director of a primary care unit here in Portugal. So Julie asked me to tell you about my experience regarding the coronavirus here management in Portugal, and I think we're having not a good experience, but not so bad. We're trying to flatten the outbreak curve, reinforcing the primary care that we have so good here in Portugal. So some of the things that I'm trying to do in my unit is that. First of all, I'm trying to shift the mindset of all the physicians and nurses from an individual individual health care, to a public health care. What I mean with this is that now we have to understand that it's less important to treat, to properly treat a tonsillitis or a headache or a stomach ache or something, in order to avoid as much as possible the exposure and the risk of the outbreak, especially inside the unit. We have several units in Portugal and all over Europe that are closing due to the infection of all the physicians, all the nurses. So we really have to have an individual care regarding our safety. But the way to do it, it's try to do not so close individual care with our patients. We are almost converted into a call center. We're using FaceTime, we're using WhatsApp, we're using videos, everything, just for the patients to have some care and to understand that we are there for them. But it's now it's more important to take measures regarding the public health, and not so much the individual care. Of course, this is in not so severe cases. Those we have to redirect to the hospital. One other thing is that we shouldn't blame the lack of the proper protection. We all know the kind of suits and masks and so that we need to use, but not all the care units have it. But from my point of view and from what I've seen, don't blame it on the material. The problem is essentially on our procedures. We as physicians don't respect the procedures. We think we are superhumans. We don't catch the virus, or if people are asymptomatic or have slight symptoms, it's not coronavirus. So we make it easy for the virus to enter our units. And it also happens that people protect from patients, but they don't protect within the professionals. So we see them eating, everyone together without masks, and it only takes one link to be opened, and all the unit gets exposed to the virus. Okay. One other thing that I adopted was to increase the number of hours of each shift, in order to not having so many people inside the unit as minimum as possible, and one personnel comes in, the other comes out immediately. Okay, so we're trying not to cross too many people at the same time. Okay. And one other personal advice that I give to all physicians and nurses, and so, don't get angry with all the phone calls that you will get from friends, from people that you barely know, from family, because they are desperate. They don't know what to do, and it's better for them to call you than either to trust on Facebook information or to go to a hospital care unit. So think that for each phone call that you get, maybe you just save one person from avoidable exposure. Okay, so anything that you need, you have my contact by MSN or email. Just ask me whatever you want. Okay? Stay safe from Portugal. Bye bye, everyone.